Hello, I'm Tom Abdenour, Certified Athletic Trainer. I've been a Certified Athletic Trainer since 1977, and throughout the course of my career, I've spent time at the high school, collegiate, and professional team levels as a clinician.
What, during your clinical experience, has made you concerned about your athletes' long-term wellness, especially related to osteoarthritis?
As an athletic trainer throughout my career, I spent a lot of time with younger athletes, again, somewhat at the high school level, but also at the college and professional team level. And the concern that I have with regard to their long-term being is always associated with their injuries, and worry that the living in the moment might give us problems down the road. I think it's tremendous that the Athletic Training Osteoarthritis Consortium has taken this as a concern, that we want to make sure that our athletes are well taken care of well beyond the times of their careers when it is finished, as well as looking at patients that we work with that may not be competitive and elite athletes, but we can learn from the experiences that we've had. I'm always worried about the athletes that I had relative to the times that they played through injury, times when maybe our rehabilitation wasn't as thorough or as complete as it should have been, but they were still functional. What kind of predisposition did that leave them with regard to problems down the road? And hopefully those chickens don't come home to roost.
What tips would you have for a young professional right now?
When we think of arthritis, we have to think of the derivation of the term osteoarthritis. It stands for basically bone, joint, and inflammation. And as athletic trainers, that's what we see a lot, regardless of the patient population that we work with. For example, if we are working with someone that's a young athlete involved in a team sport, we may be looking at something down the road that could develop with regard to a lower extremity situation with regard to arthritis. It's extremely important that our rehabilitation be as thorough and complete as possible. Granted, we have a lot of motivated young athletes that we may work with who are copers, the one who can fight through pain, fight through disability or inflammation, but could develop a problem down the road. A case in point would be an NFL football player who develops arthritis in the foot, secondary to a fractured navicular. Studies have noted that 75% of athletes who do have a fractured navicular could end up in an arthritic situation, which impacts the quality of their career, as in cutting it down. Therefore, the rehabilitation that we have with arthritic situation needs to be as thorough as possible, to include things like joint mobilization, strength, balance. All of the tools that we have all have a long-lasting effect. One of the other things that we can do also is keep track of how our patient population is doing. One of the most simple things that we can do is track them with an outcome scale, a patient-rated outcome scale with regard to the arthritic situation, such as one that's for knee and ankle osteoarthritis or hip osteoarthritis, or any other kind of general outcome scale or health-related quality of life. Those scales are simple, easy, patient-rated, so we get the outcome information from the patient themselves, more so than the clinical tools, which are also extremely important with regard to range, motion, and strength. So that whole package is we as athletic trainers can help prevent situations from occurring down the road by being as thorough and diligent as possible in the short end, recognizing that sometimes athletes may not be the strongest advocate and want to continue to play. And we have to advocate for their long-term health by trying to prevent something that they may not even be thinking about 10, 15, 20 years down the road.